This is a video on how to set up for root canal stage 1 and 2. So first you'll get a root canal 1 kit. So if it's root canal 3, that's a different kit. Triplex, burr block, high speed, slow speed handpiece, endo handpiece, ultrasonic handpiece, and ultrasonic tip. And that's for the dentist side with the ruler. And you'll also want to set up for the syringes like an LA and numbing cream. For DA side, you will have a rubber dam and the holder, and you will punch a hole using this instrument. And then you need a clamp. This is a clamp holder. Cavet, mix and mix tip. Cavet, and with cavet you want to take it out with a spatula. I don't have. You want to take it with a spatula, and you want a bite block. And those sponges for the files, gauze, and you will fill up both hypochlorite and EDTA in 2 separate cups, and then fill it up into the syringe with a needle. And here's the surgical suction that is not disposable. And if you need activator or rotary handpiece, you can find it outside. This is the rotary handpiece, which is the activator. And then its handpiece over here. And the activator tip, you can find it here. It's a blue one or silver one.
So right now we're setting up for the root canal. This is root canal stage 1 and 2. So we're getting the root canal stage 1 kit. If it's a stage 3, we have 3 on the side. We need filling stuff as usual: high speed, slow speed burr block, ultrasonic body, ultrasonic tip, and the triplex. And then in extra, we need the ruler, and we need the rotary handpiece, which is this one, this machine, which is fine on the trolley, and then it's head for it, which is fine on the trolley as well. And then for the DA side, we can set up chronologically. So when the patient first comes in, we have to numb them up. So make sure we have numbing cream and Q-tip ready for them. Afterwards, we'll be numbing them up with LA. So we're getting the syringe, either allocaine or lignocaine, and then the needle, either long or short. And then afterwards, we'll be putting a rubber dam on the patient, which is this thing, which could be found in the endo drawer. The hole puncher, the clamp, depends which tooth it is, the clamp will be different. The clamp holder. And then afterwards, we'll be thinking about what's going to happen next. So after the dentist drill the hole into the tooth, we need to make sure we have the files out ready. These are hand files, either H files or K files. And then the sizing depends on the different file and the label on top of each file. Afterwards, we need to get the endo activator ready, which is this machine, which can be found on the endo trolley, and then the tip that comes with it, which is this one. DAs also need to have a surgical suction. DAs need to have a syringe with a tip, with a needle tip. And then we'll be using hypochlorite. So how to prepare hypochlorite is, you grab a cup, and then you pour around, maybe not that much, like just a little bit. Okay, and then you label it H for hypochlorite on the side of the cup. Okay, and then afterwards we need a sponge for the dentist to put the hand files in. We also may need an X-ray, just in case we need to take any X-rays. And then this thing is called paper point. And this can be found in the endo drawer. We also need Calmix, which is like a medicine, and also odonto paste. We also need Cavit. Cavit is after the cleaning of the canal, and we have to fill it. And then we need a spatula. And then we need something called Fuji 7, which can be found in this drawer here, with the with all this Rotomix.
You don't need EDT here.
We'll just do HerbClar for now. And then we also need articulating paper because we have to check the patient's bite after. And that's it.